Great, and you can begin when you're ready.
Hello, everyone. Good morning, good afternoon, good evening. We are so delighted to welcome you to the 8th session of the Climate and Health Responder course on climate change, mental health, and forced migration. We have an incredible lineup of speakers today, and we're so glad you're here to join us. As a reminder, we have simultaneous interpretation available in English, French, and Portuguese. You can select your preferred language by clicking on the globe on your Zoom toolbar. As a reminder, there is a total of 11 sessions during this course. They take place every Tuesday and Thursday at this time. If you've missed any of the prior sessions, you can find the recordings on our website, and you'll see the link in the chat shortly. As a reminder, we have an upcoming session this Thursday, which will be our second to last session, actually, or third to last session. So we hope to see you there as well. As a reminder, we are giving a certificate of participation for participants who attend 8 or more of the live Zoom sessions and pass a final exam at the end of the course. Just to remind you that your attendance is automatically recorded when you join the Zoom platform using the link that was provided when you registered for the course. So, that's already been said. We have an update on the final exam. We are extending the amount of time you'll have at the end of the course to complete the exam. So the course will conclude on October 22nd, which is a Tuesday, and we are going to give you 5 days. So we will give you to the following Sunday to take the exam, and the exam link will be emailed to you. So just so you can relax a little bit, you'll have 5 days to complete the exam once the course is finished. So we have an amazing session lined up today. The learning objectives are here, and they can also be found on the website. But this is just a reminder that these learning objectives are based on the GCCHE core competencies for health professionals and are really rooted in evidence-based science and practice. One more important announcement. The Global Consortium on Climate and Health Education, in partnership with the Global Network for Academic Public Health, has partnered with the Lancet Countdown to do a survey looking at how climate change and health is currently being integrated into the training of public health professionals globally. This is the second year that we are deploying this survey, and we did not get great representation from Africa last time. So I'm using this moment to invite anyone here who is faculty at a school or institution of public health that is a degree granting institution that trains people in the field of public health to please take this survey. It will take you about 10 to 15 minutes to complete. Whether or not you have climate or health education, we're agnostic. We just want to know. And we invite you to take this survey. There's a link in the chat for it, and the survey will be open until December 1st. So please take the survey if you are a faculty member at an institution of public health anywhere in the world, but especially in Africa. So without further ado, I'm delighted to introduce our two panelists, our two speakers for today. The first is Dr. Samson Miha. He is a PhD and the chairperson at the Faculty of Applied Psychology and the Faculty of Social and Behavioral Sciences at the University of Zimbabwe. And then we have Dr. Elaine Flores, who is a research fellow at the Center on Climate Change and Planetary Health at the London School of Hygiene and Tropical Medicine. So first we'll hear from Dr. Miha, and then we'll turn it over to Dr. Flores. And so with that, thank you all so much for being here today, and we look forward to a great Q&A and discussion following these presentations.
Thank you, Cecilia, for the wonderful introductions. Let me...
From beginning.
Yes, from beginning. Right. Thank you for the wonderful introduction, Cecilia. My name is Samson Meja, as had been said by Cecilia before, and I'm happy to be presenting this to this wonderful audience. Now, I'm on climate change and mental health. I am very happy that we had an introduction on climate change before, so it's not going to be necessary for me to start explaining what climate change is and what it is not. But I will be also talking actually about mental health and how it links with climate change. To start with, it's very interesting to note that mental health, as has been defined by WHO, is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stress of life, can work productively and fruitfully. So we are saying mental health allows a person to be productive, to realize their own potential, cope with their own normal stress of life, and to make contribution to their community. Now, climate change is a risk amplifier for our vulnerabilities. What am I saying here? I am saying climate change does worsen our challenges, our vulnerabilities. It may not have created them, but it worsens our experiences of them. It's actually a health issue. And we were also saying mental health combines both spiritual, emotional, and cognitive well-being. And it's not just merely an absence of a mental disorder. What I need to say from the beginning is that in Africa, it's very interesting that we are not really disciples of science, as is the case in other continents. When it comes to mental health and climate change, we have interesting perceptions. I have been involved in studies myself where people can tell you that they believe that climate change is explicable in terms of what God has done or what God is doing or what our ancestors or other spiritual beings are doing. In the Bible, it talks actually about punishment, or in the end times, there being droughts, flooding, stuff like that. So people in Africa sometimes believe that climate change is the result of actions by God. And also that mental health is also a result of what either God or our ancestors or other spiritually powerful beings can be doing to our lives. Now, you can see from this image that we have traditional hazards and modern hazards. Modern hazards, we're talking of industrialization, human activities, then the emissions involved from that, getting actually involved with air, water, food, soil, giving actually mental health effects. We also talk actually of one healthy, where what happens in our forests, in agricultural fields, species, natural areas can also have mental health impacts. Then also talk of drought, floods, temperature increases, also being affected by all those factors such as belief in spiritual causes, refusal to leave homes, poverty, decline in extended networks, then leading to mental health issues. Now, let's now talk actually about vulnerable groups in Africa when it comes to climate change. Africa contributes the least to global warming because there are fewer industries in Africa. And in some countries, there is deindustrialization where industries and factories are changing into prayer rooms, into churches. So we are contributing little the least towards global warming in Africa, but we suffer the worst impacts. Poverty is one of the factors that worsen our vulnerability. Also governance issues, you know that there's corruption in Africa, poor access to basic services, violent conflicts, low research outputs. That's very unfortunate. We'll talk more about that later. Lack of studies, stigma, superstitions. All those actually worsen our vulnerabilities. So the vulnerable groups, when it comes to mental health and climate change in Africa, include those economically disadvantaged, the poor, climate refugees, those who are internally displaced because of climate change impacts, such as flooding, women. Sometimes climate change does have a gender face, but when I'm talking actually about these things, I'm saying these vulnerabilities manifest in terms of mental health challenges. The rural, because Africa is an agro-based livelihoods, those with pre-existing mental conditions, the elderly, because they are less mobile, they have poor health, and sometimes they're neglected. Children, in many African countries, children actually, because of climate change impacts, end up being school dropouts, child soldiers, in child labor, or even feminine brides. They get married to help their families get food. And also people with disabilities. You will talk of those with albinism, especially in the context of high temperatures, street vendors, and informal traders, and the homeless. These actually have worse vulnerabilities. So we are now saying the climate change does affect us in Africa in a number of ways, people, especially for children. Now, when it comes to research, WHO intimated that an estimated 2% of total research from output in Africa is on mental health. We are doing little, if anything, when it comes to mental health in Africa. And Africa reports the lowest government mental health expenditure per region, just 0.46 per capita, to a global average of 7.49, less than $1, less than 50 cents for that matter. And the lowest number of mental health workers at 1.6 per 100,000 people. So this is concerning. We are not doing much. Remember, I said before that in Africa, we have a problem that we are superstitious, we are spiritual, especially when it comes to mental health. When a person presents with mental health challenges, instead of consulting mental health professionals, we sometimes consult spiritualists, pastors and prophets, and not psychologists or psychiatrists or mental health nurses. Now let's talk actually about climate change and forced migration. Climate change induced forced migration can have profound psychological effects before, during, and after migration. And the factors that these things include loss of family connections, social support networks, which become reduced because these climate refugees are being forced to stay in areas where they are not used to. There's cultural dislocation, and they also have stress of adapting to that new environment. So many of these tend to alcohol abuse, use of substance as a coping mechanism. So these climate refugees often face discrimination challenges in accessing essential health and other social services and finding stable housing and employment. You talk actually of xenophobia. In Zimbabwe, people actually live in large numbers to stay in South Africa, as are people from Nigeria, as do people from Mozambique, Lesotho, Zambia, Malawi. But they also face xenophobia there. Children and adolescents are particularly vulnerable, and they would also require age-specific interventions to address their psychological symptoms and challenges they face. So poor mental health is one of the significant problems affecting climate migrants, especially from droughts in Africa. Now, I'm showing this a diagram of the population that is affected by climate change globally. So you see that in Latin America is 17 million, South Asia 40 million, South Asia in the Pacific 49 million, Eastern Europe 5 million, North Africa 19 million, but Sub-Saharan Africa 86 million. We are not talking here of those who migrate to Europe, crossing the Mediterranean Sea. No, we are talking of those who are migrating within Africa, not beyond Africa. So the challenge is worse in Africa, as you can see. You see climate change, migration, and health. So these three concepts come together to affect the people in Africa. And you can see that children and women are the worst affected if, as you look at the image that I'm putting across. Now you can see, I'm talking actually about what is happening in South Africa. 1 in 6 South Africans suffer from depression, anxiety, or substance use disorders. 1 in 3 pregnant or postpartum mothers have depression in South Africa. 17% of children and adolescents have mental disorders. And climate change plays a big part in all this. Now, let's talk of the mental disorders that result from climate change. When you're talking mental disorders, you are talking of the mental health challenges that are normally diagnosed by mental health professionals. But in this case, we are talking of those that are resulting from climate change impacts. Now, the dread of environmental disaster results in what we refer to as eco-anxiety. When people are feeling worried or anxious about environmental disaster, for example, we talk of droughts, we talk of flooding, that is eco-anxiety. But when we talk of the anguish from or in anticipation of ecological losses, we talk of ecological grief. We are anticipating losses. That may be in terms of our homes, in terms of our property, even in terms of lives. You see what is happening in Florida, in America. Lives are being lost. Property is being destroyed. So when we hear that actually that the flooding is going to happen or the drought is going to happen in our countries, we actually feel that we anticipate those losses, and that is ecological grief. Then there's this interesting terminology, what is we refer to as solastalgia, which was coined by Glenn Albright to describe the feeling of homesickness when one is still at home, but because of environmental change, the home no longer looks familiar. It's no longer homely. So the person feels solastalgia. This leads to disintegration of cultural ties between people in their land, and it may be caused by droughts, floods, fires. Now, what we are saying here is that you may remain in your home, but you feel that the home is no longer feeling homely because of the climate change impacts. It may have been partially destroyed, or you are no longer getting the warmth, the protection that you used to obtain from it. This is as opposed to nostalgia, which is homesickness experienced by individuals when separate from a loved home. Now, let's also talk of floods and PTSD. Exposure to storms or floods results in increased prevalence of mental disorders compared to the global rate. Studies do show that acute events such as floods were comparable to established mechanism of trauma, resulting in a range of psychopathological outcomes. Post-traumatic stress disorder is a commonly cited outcome from acute stress experienced during and immediately after an extreme weather event. Other outcomes following such events include depression, general anxiety, suicidal ideation, and the misuse of drugs and alcohol. So what we are saying here is that PTSD happens when a person experiences a life-threatening or a traumatizing event. So after that event, they can relive that experience, and that affects the people mentally. Floods and droughts. Studies among flood victims, their mental health outcomes in Namibia, Burundi, and Nigeria have shown actually they also experience PTSD, depression, and traumas. In terms of droughts, victims of drought reviewed that drought-related losses significantly predicted current trauma symptoms, with females reporting higher symptoms than their male counterparts. Among children, it's even worse because children would have mental health challenges, particularly because they face poverty worse than adults. There is also a common belief among guardians that children's mental health is not an issue, as their physical needs were being met. There are also gender differences, as girls suffer more than boys from drought effects. Some end up engaging in sex work. We also talked of feminine marriages. But the studies also present conflicting results, as some participants report less psychological distress during periods of drought due to financial support from government. But not all governments from Africa are able to support their people. Drought is also associated with depression, hence farmer suicide, because people would have invested a lot, but they would lose everything. Extreme heat and bushfires. Details from studies show that studies conducted in many countries show that extreme heat lead to suicidal effects and reduce the quality of life. Because in fact, Africa is already hot. It's a warm continent. But then it's worsening, and that can also have a lot of challenges. We'll talk actually about heat and mental health in the next slides. Also, bushfires can lead to worse psychological distress and other mental health challenges, such as disturbed sleep, anger, intrusive thoughts, and anxiety. Now, multiple extreme weather events, it's actually sometimes disquieting that in a single season or in a single year, people can experience drought, heat waves, and flooding, where they do not have enough rain for their crops and livestock, but then they would have floods that destroy their homes. So those are multiple extreme weather events that can cause a lot of mental health challenges. We talked actually of ecological grief, eco-anxiety, PTSD. So we are saying these extreme weather events, there's flooding, drought, bushfires, extreme heat, create problems for people, especially in Africa, and those are the psychological disorders associated with them: alcohol use, stress, disturbed sleep, anxiety, depression, suicide. Now, food insecurity and mental health. Climate change is disrupting agricultural systems in Africa, causing food shortages and raising concerns about food insecurity. Climate extremes, economic downturns, and wars in Africa worsen the experience of people, especially among children. There is a lot of malnutrition among children in Africa. School-age children from Africa suffer from early childhood malnutrition, have poor IQ levels, poorer cognitive functioning, poorer school achievement, and attendance for that matter. In fact, when there is food insecurity at home, children normally end up working to help the family secure food that they drop out from their schools. There is a strong evidence that malnutrition impairs neurodevelopment and academic achievement among children.
Samson, hey, it's Cecilia. Can you slow down just a half step so our interpreters can keep up with you?
Okay, noted.
Thank you.
Okay, so we also talk of anxiety, depression, and grief vis-a-vis climate change. We are saying it's one of the most serious effects of climate change: anxiety disorders, depression, feeling intense worry and fear and tension, and intrusions because of climate change. Post-traumatic disorders have been reported in climate hit communities in Africa and Asia. In Africa, it is even worse because, like we said before, we do not conduct a lot of studies to determine the relationship amongst these factors, especially climate change, mental health, and forced migration. I'm happy that in the previous sessions, we discussed air pollution and its link to health. But now we want to look at climate change in terms of air pollution and mental health. Climate change is associated with air pollution and has been reported to result in poor mental health experiences. Researchers have reported that air pollution does create substances that can also be similar to something that we also find from bushfires, leading to depression and anxiety. And other outcomes that have been reported from this include delusions, hallucinations, and disorganized thoughts. There is also a risk of hospitalization and emergency department visits, reporting depression as well as anxiety experiences. Now we may discuss climate change and violence. This is one of the most interesting experiences that has been reported from literature. The relationship has not been that clear. We cannot say climate change causes violence, but what we can report is that where there is increase in temperature, there has been reports of increase in terms of violent experiences. We talk of intimate partner violence, we talk of domestic violence, homicidal experiences, even suicidal experiences, which is intrapersonal violence. So extreme heat threatens the safety and well-being of the most vulnerable women and girls across Africa, with the heat stress putting the health of pregnant women and their babies at risk, increasing the chance of preterm birth and stillbirth. So we are also reporting that climate crisis, especially as explained by increase in temperatures, leads to homicidal crimes at societal levels. Another interesting issue to talk about is climate change and substance abuse. Literature is showing that there is a relationship between substance use and climate change, but the relationship may not be that direct. It may be both direct and indirect, particularly because of stressors. The stressors may be in the form of increased floods, humidity, heat, drought, and rainfall, especially flooding. They are ultimately associated with the self-harm and suicidal behaviors, increased hospital psychiatric admissions, psychological distress, and higher mortality rates among people with existing psychiatric disorders. We are also saying that climate change does limit economic opportunities for people. And because of the reduced economic opportunities, the people end up being idle. Sometimes substance use becomes an occupation as people occupy their time using or abusing drugs. But there's need for further research on this. Higher rates of substance misuse have been reported among people displaced and exposed to extreme stressors in South Africa. Again, the stigma of substance use and mental illness affects the disclosure and help-seeking behaviors among these people. Now, this image, a diagram on climate change and mental health. We talk of the mental health disorders, the climate anxiety, interacting with economic and social threats, chronic changes, acute events, to create mental health problems for people, particularly in Africa. Now you see the impact of climate change on mental well-being, extreme weather events, climate change, then affecting social services, exposure to diseases, then poorer mental health. Now, you can see in KwaZulu-Natal in South Africa, in Durban, there's been a lot of climate change impacts, particularly flooding, which has affected people there, killing many people and displacing a number of them. Now, let's move on to recommendations, because it's not important for us to discuss these problems without looking at how we can deal with them. It is important for us in Africa and also others from outside Africa to have increased recognition of mental health as central to human development. I'm very happy that we are having these presentations, particularly this mental health presentation on the 10th of October. The 10th of October is the World Mental Health Day. Across the globe, people were celebrating today the World Mental Health Day. It's very important that we invest a lot of our efforts, a lot of our resources towards this important phenomenon. There's need for increased investment in mental health promotion. It's also very important to integrate mental health concerns into climate change reduction programs. Every year, there are climate change conferences globally and nationally. And it's important that people start integrating mental health in those programs, in those meetings, those conferences. It's also important to look at resilience and adaptation. I'm happy to report that myself, I've been working on a project on resilience building among children living and working on the streets and those who have been reunified with their families. So it's very important to deal with the mental health impacts of climate change by involving adaptive strategies at individual, community, and societal levels. So we need to develop, strengthen, and promote access to and use of integrated mental health services under universal health coverage arrangements, support networks, and coping mechanisms so that people can be able to handle their psychological challenges, which are especially associated with climate change. It's very important to develop psychological resilience to the effects of climate change. So where young children are leaving schools, others are getting married because of droughts, because of flooding. It's very important that we develop resilience among these children and that we ensure that they remain in schools. And also we need adaptive capacity of communities. On Tuesday, we had a presentation on agro and food security systems. I have been advocating myself that it's very important that we also revert to traditional grains that normally help people. And I advance the concept that I refer to as the maize poverty trap, where many communities, many people in Africa are obsessed with the growing of maize, which, however, in drought-prone areas is not viable. So if they are to grow the traditional grains, that may be better. Then climate activism can be a positive coping mechanism. Across the world, it is noted that climate fear has taken hold in younger generations. There are over 70% of people who were surveyed who showed that they were extremely worried or very worried about climate change. How do we do with that? Why these people are worrying? It's very important that we develop climate activism among the youth, grow climate activism and engage them as a way to deal with the extreme worry, the extreme anxiety that the youth would be experiencing. Many individuals would find meaning and purpose in advocating for environmental sustainability. So taking action to address climate change can provide a sense of urgency and hope, counteracting some of the negative emotions associated with the climate crisis. Integration of mental health issues in the disaster response planning, including for those with pre-existing conditions, can also help. There's also a need to invest in research about climate change, mental health, and well-being. Now, I was interested and surprised at the same time to realize that one university in America had a budget of about $3 billion just for research, when in Africa, that can be a budget for the whole country. And in Africa, it is agreed nationally that countries should invest about 2% of their GDP towards research and development. But in Africa, I think there are only countries like South Africa, Morocco, Tunisia, and Egypt who do something, who invest something towards research. But we are arguing that every country in Africa should invest in climate change and mental health research to help the people in the continent. It's also very important to include mental health indicators into climate change surveillance systems. There is an interesting initiative from Zimbabwe, which is referred to as the Friendship Bench Initiative, which was even showcased at the recent World Cup in Qatar, where lay people are trained to offer mental health interventions to the average people. And that has been shown to help in a big way. There is also a need for prioritization of health in national planning adaptation agenda, and to invest in climate resilient healthcare systems. And it's also important to have research as a key component of those systems. Then there's this issue of One Health. It's still sometimes not understood by many people in Africa, where we are saying the health of our natural environment and our own health, not just physical health, but mental health, is interconnected and should be respected as such. Then the priority of research, which need to be set also in Africa. Now, look at that image. You can see that is a man seeking mental health support services from that woman. And let me tell you that I also argue myself that men are a new vulnerable group. How so? because they're expected, especially in Africa, to provide food on the table. But the opportunities are not planned for them, one. And secondly, they are socialized not to seek help. And the help-seeking behaviors are kind of dysfunctional. Sometimes they engage in self-help without approaching the professionals. But in this case, we are saying that men approach that professional. But what is that professional doing and saying? She's saying, so what is making you so anxious? But look, they are both immersed in a climate change disaster. They both need to be helped from their situation. But that professional seems unaware of the challenge that is affecting their community, their natural environment. That's how important these sessions are, because it's very important that everyone becomes aware that we are in a climate change, in a natural disaster, is the whole planet. However, she appears ignorant, and that man is showing also signs of surprise. But in the same token, we need to raise awareness amongst these men so that they seek help and themselves, and also help their families seek help. Because mental health, from a psychological perspective, needs to be prioritized from early childhood, from the family, from a holistic perspective, and that everyone needs to come together. We also advance what we refer to as transdisciplinarity, where we bring everyone on board, including policymakers, researchers from academic institutions, the communities who should benefit from the outputs of those research studies, and that people should come together and co-create. They should agree on the problems and co-create the solutions for everyone. The unfortunate challenge in Africa is that normally the leadership, whether at national level, even at academic institutions, they believe that for as long as the leaders, they do have the answers for all the questions, yet people should come together to agree on the problems, on the challenges, and also agree on how to solve them. So what we are saying is there is no adequate health without mental health, and that mental health has been neglected in Africa. And remember, we said in the beginning that Africa, the majority of people there are superstitious, are spiritual. We need not to neglect them, work with them, including the religious leaders, the church leaders. Various research studies do show that the majority of Africans do not trust their national political leaders much, do not trust their researchers much. They trust their religious leaders. So we need to work with their religious leaders and agree with them that there is a problem. In as much as climate change was prophesied in the Bible, but there are things that we need to do as a people to solve those challenges, and we should solve them together, including them, including their congregants. I thank you. Back to you, Cecilia.
Thank you so much, Dr. Mihra, for that incredible presentation. So much information. Really, really great to have this perspective shared out in the open. I think there's going to be a lot of conversation that follows this, and we really look forward to this discussion. Please put all your questions in the Q&A section. We'll get to as many of them as we can when we have the discussion. Next, I'd like to turn it over to Dr. Flores for our case study. Thank you, Dr. Flores.
Thank you so much. I will be sharing my slide. Just 1 second. Okay, just to confirm, are you able to see my
Looks
presentation?
perfect. Yep.
Thank you so much. And well, I just want to also thank Cecilia, Haley, and the organizers for inviting me to contribute to this fantastic and very timely course. I will be complementing the very interesting lecture that Samson has given in this often overlooked nexus. I will be following loosely this outline, some concepts and statistics maybe to complement, and sharing some findings from a systematic review that I co-authored, and a brief also discussion on a qualitative case study that was done with stakeholders across 3 countries in the Horn of Africa, and what recommendations we can highlight in the topic. My presentation will be more brief than the one of Samson, just to be discussing some of the points that I would like to highlight. So about some statistics and concepts that we discuss in this nexus from a humanitarian point of view, as we know we are within a climate crisis. We see that by the end of 2023, for example, we have over 117 million people, which now I mean, this is the latest statistics that we have, but as we can see, people were being forcibly displaced due to several reasons, but mostly due to persecution, conflict, violence, human rights violations, in an increase of 8.8 million from the year before, on a continuous series of yearly increases over the last 12 years. And we can see that the global rates of forced displacement have rapidly increased. We also must consider that a forcibly displaced person will likely be displaced multiple times and across many years. So just taking in mind all the stressors and all the risks that Samson discussed in their lectures, and that you have also been seeing in the previous sessions, we will also have these categories. There will be 3 main ones of displaced people that we need to take in mind. First, a refugee, which follows the following concept. Now, is a person fleeing a disaster or persecution who has crossed an international border and cannot return home. So we have more than 2/3, over 69% of the world's refugees displaced, coming from 6 main countries: Syria, Ukraine, Afghanistan, Venezuela, and South Sudan, per the last year statistics. An asylum seeker will be a person awaiting a decision about their status as a refugee, and an internally displaced person are those who have been forced to leave their homes, but they have not left their country. And it's a huge group. By the end of 2022, we have almost 61 million new displacement recorded across 151 countries. So this we are seeing records every year, and we have that a huge number of them, almost 32 million people that were internally displaced, whereas it was associated to extreme events and disasters. And unlike refugees, IDPs are not entitled to international protection. And also, despite I mean, in some specific cases, for example, civil wars or other crises, national governments will be part of the problem. So as a result, we will have that for internally displaced persons, the health outcomes will tend to be worse due to this lack of access to protection and resources. And now, just following up on what the previous lecture explored, we have that we have a clear nexus on how conflict, migration, and climate change are interconnected and also affecting the mental health of millions of people around the world. So just to give us an idea of the magnitude, we have that, the humanities basically doing a global migration phenomenon. Around 170 million people living outside their country of origin. And additionally, each year, several 700 million more will be crossing national borders. So more or less 1 in 10 people in the planet are moving within countries annually. And also they will be sending money. And this is something that we know that it underlines an enormous economic impact linked to migration. So it's not just of individuals or communities, but for the entire nations. And there are several factors that will be pushing people to leave their homes, but forced migration is a reality for millions. This will include displacement due to colonization, which continues to affect low and middle income countries, as well as indigenous populations. Racial discrimination, human trafficking are also other factors that will force people to flee. And as you have been highlighted in this course, previous sessions, we have that an increasingly important factor being climate change effects. So we have certain regions becoming uninhabitable due to droughts, floods, or rising sea levels. So more people will be forced to relocate. And finally, as we have seen, we have asylum seekers and refugees fleeing direct threats to their life or freedom due to conflict or persecution. So we have to understand that mental health risks for migrants, and especially the other people in the other categories as asylum seekers and refugees, these risks to their mental health will be present in every stage of their country. Before migrating, they may experience trauma due to conflict, persecution, or disasters, as we have seen. But also during the migration process, it will be often involving dangerous journeys and precarious conditions that will make people exposed to further stress, potential trauma. And for those that arrive to a host country, the experience of seeking asylum itself, it can be extremely stressful as well, no? With a lot of uncertainties and fears. So when we have people arriving in a new country, they will continue face challenges as culture shock, language barriers, discrimination, difficulty accessing basic services. So everything will be affecting their mental health. And as Samson acutely mentioned, we know that climate change is an amplifier of these factors. So in this context, the rising disasters, environmental degradation are creating a new class of migrants. Now we have the climatic refugees. So we will have like an additional layer of complexity in the already global migration crisis that we have seen and its impacts on mental health. So research is, of course, challenging to conduct in humanitarian settings. So it will be difficult to estimate the incidence and prevalence of mental disorders and mental health conditions in crisis-affected populations. But we have some reports from the WHO, for example, the one in 2019 estimates that in conflict settings, 1 in 5 persons will be living with some form of mental condition, from depression to anxiety to psychosis. So in general, we expect that the rates of depression, anxiety, somatic distress, and harmful use of alcohol and substances will be elevated. And many of those affected will be expected to recover naturally over time. However, an important group will not be able to recover without accessing substantial mental health and psychosocial support. which may come with their own barriers and may experience symptoms for many years. So we have a global meta-analysis conducted by Blackmore and colleagues in 2020, examining the prevalence of mental illness across global refugee populations. And the key findings, you can see that in the slides, will include high rates of PTSD and depression among the refugees, which persisted for a long time after the initial resettlement. And often when people will be talking about the impact of humanitarian crisis on mental health as the displacement, we will be highlighting the relationship between the exposure to negative events, such as losing family members and the onset of common mental disorders. However, when this type of climatic disasters strikes, we will have people that some of them, they will be having pre-existing mental conditions, and they will often find themselves in particularly vulnerable situations. So not only the risk factors posed by the humanitarian crisis itself in the setting, but also the deterioration of their protective factors will be of concern, as has been reported in this systematic review by Bactan and colleagues. We see in the slide a potential possible pathway by which the psychosocial stressors and protective factors interact, taking into account all the pre-existing mental health and psychosocial status, as well as the subsequent life events shaping the status post-displacement. The other thing that I wanted to share is about it's a systematic review that we did, trying to find, aside from the statistics that we know regarding the increase on climate-related events and the frequency of these environmental events leading to displacement. So we know that there has been increased number of events between the last 2 decades. And unfortunately, we also have an increase in the number of displaced people. We expect that more than 1 billion people will be displaced as a direct result of climate change over the next 3 decades. So what we wanted to find was about what exactly it will be the prevalence and of the climatic-induced displacement on their mental health. And what we tried to find was studies reporting the prevalence of mental disorders, including substance abuse, in those directly affected by extreme weather events or other direct impacts of climate change. In the end, we found 78 studies that were published between 2001 and 2022. 45 of them focus on, let's say, temporary displacement after a climatic event or extreme weather event. 9 studied permanent displacement, and 6 were on both types of displacements. More than 70% of the literature that we found focus on hurricanes. Floods and other environmental hazards were a smaller number. And unfortunately, as you can see from the map, from the systematic search that we did, there was a very uneven distribution in the number of studies that we found published. So 57 out of 78 were focused on North America, in the United States, Canada, only 15 studies in Asia, a very small number of studies in South America and Europe and Australia. So we didn't find actually from the African continent studies that have been published that complied with our inclusion criteria. So I just wanted to highlight this because, as we know, we have we are aware that the majority of displaced persons are internally displaced ones within their country. And most of the studies that we found focus disproportionately on big hurricanes such as Katrina and Rita that occur in the United States. So we definitely lacked data. But from what we found from these studies, most of the results included elevated levels of PTSD, depression, anxiety, followed by psychological distress and hopelessness, feelings of suicidal ideation, and other conditions were reported linked to the consequences of displacement and mental health. So there were not a lot of follow-up. Most of the studies were up to 5 years after the displacement. So there were also some suggestions in some of the studies mentioning biological effects, either combined, for example, high stress, cortisol levels, that remain high in some populations despite being displaced for a very long time after the assessment. So the risk factors actually comply with the rest of what we know in the literature. Being a woman, for example, made people 3.5 times more likely to experience worse mental health outcomes. Factors such as the time that has passed since the displacement, the distance that a person was displaced from their home, and even the mental health of their parents seem to have an effect. So from the results that we have seen, and of course from the data that we have about climate change, this is alarming. And we have a lot of people that are losing their homes, and the consequences, let's say the direct consequences of being displaced is something that we don't have enough data to say, but we know that the representation from the African continent linked especially to a lot of the devastating effects that we have seen, such as droughts and floods, is very alarming, and we need that. I mean, there is an urgent need to address this lack of data. And now, I'm so sorry that it took a long time to review the previous point, but I will just discuss this case study that I wanted to share. That it was conducted in 2018 and focused on 3 countries in the Horn of Africa: Somalia, Kenya, and Ethiopia, which, as you well know, are highly vulnerable to climate change and experiencing increasing temperatures, erratic rainfalls, and prolonged droughts. The research team partnered with 8 country partners with expertise in health sciences and climatology. So it involved 39 participants across the 3 countries, including professionals from UN agencies, government ministries, NGOs, regional leaders. 30 males and 9 females composed the stakeholder group, and they performed 2 phases of data collections: in-depth interviews and then a validation workshop where the preliminary findings were discussed. And the data actually is really interesting. We know that as we can see, we have climate-induced migration in this area, presents a complex and varied patterns across the 3 countries. So there are several millions of people internally displaced, many of whom were forced to move in Somalia, for example, due to a combination of conflict and climate-related factors. A significant portion of these internally displaced people have settled in informal urban settlements. And this urban influx have led to overcrowding and strained resources. And regarding Kenya, the experiences, it has been experiencing recurrent displacement, particularly in the arid and semi-arid lands. And of course, the country hosts a large refugee population from neighboring countries affected by both conflict and climate change. And it also, pastoralist communities internally being displaced is common, that because they are particularly vulnerable to climate-induced migration as their traditional grazing lands becomes less viable. And in Ethiopia, of course, there is projections, but of course, people, millions of people have become internally climate migrants, primarily driven by water scarcity affecting agricultural productivity. So in the slide, you can see that across the three countries, there were some common trends emerging with significant implications for health services and urban planning. I will go to the next one. So in terms of the mental health, what it was discussed in this case study, it was characterized by high needs and limited resources. Each country will be facing unique challenges, as you can see also in the slides, in terms of a lot of people, almost 33% in Somalia was affected by mental health issues. However, the services are severely limited, and also ongoing instability has made it challenging to maintain the mental health infrastructure. Kenya as well, there is a very small percentage of its national health budget allocated to mental health. So there will be significant service gaps, and leaving rural populations and displaced communities underserved. And of course, in Ethiopia, the country will be facing a severe shortage of mental health professionals. So across the region, the common challenges are there and will be including stigma, preventing people from seeking care, lack of trained mental health professionals, especially in areas that are hosting already a large displaced number of people, cultural barriers as well as limited research on the mental health needs of climate displaced population, as well as competing health priorities. And as it has also been mentioned, gender-based violence is a critical yet overlooked issue among these displaced populations in the area. So it's an increased vulnerability for women and girls, particularly in informal settlements and in displaced people camps. And these risks increase dramatically during displacement. And the barriers, of course, we have, as I have already mentioned, there is a severe shortage, but also the lack of integration with primary care makes that many mental health issues go undetected and untreated. Of course, the cultural stigma as well, it was mentioned as linked, highly prevalent across the three countries, that often prevents individuals from seeking help even when the services are available. People will be they will view asking for help as a sign of weakness or a spiritual failure, contributing to the social isolation. As Samson also mentioned, there is a spiritual point of view that will prevent some people to seek help, and as well language barriers. And we have a lack of culturally appropriate mental health assessment tools. So I don't want to end just saying all the all the challenges that we have. There are some innovative approaches emerging that will require a lot of input to continue assessing and addressing the mental health needs of climate displaced populations. As I have mentioned in this slide, there has been growing emphasis on using community health workers to provide basic mental health support, especially in remote areas, which may be promising in similar contexts. Community-based interventions as well, involving local leaders and traditional healers. Also, it would be something to help the acceptability of mental health services. Mobile clinics as well, hopefully that will be able to reach nomadic and pastoralist communities. But still we have knowledge gaps that we need to understand better to be able to address these needs. Aside from the data that I have highlighted, there is a limited understanding on the long-term mental health trajectories, especially for those people that are experiencing repeated displacement and other additional social determinants affecting their mental health. And as well, we need more research, but also more action on the intersection on gender-based violence. So I just have to add a very few recommendations following the fantastic recommendations given in Samson's lecture. But based on the case study and also in the limited literature that we have in the area, I definitely is crucial to integrate basic mental health screening into all health services for this population, for refugees, for internally displaced people. Also developing and implementing culturally appropriate mental health first aid trainings, especially for providers and community health workers, strengthening as well community-based mental health support systems, of course, working with local leaders, traditional healers, community groups, and advocating for increased funding allocation to mental health services, as well as promoting collaboration between sectors, between health, social services, education, and livelihood programs to address the underlying determinants of mental health. Yes, I think that will be all for me. And thank you. Apologies that I have run for some minutes over my presentation.
Amazing presentation, Dr. Flores. Thank you so much for that. And I'd like to invite Dr. Mija back. And we have so many incredible questions from the chat, and we've tried to sort of group them and summarize them and look forward to this conversation. And so I'd like to start with our first question. There's a question here of, how, we know that there's a huge dearth of mental health workers in Africa in general. Actually, this is a global trend worldwide in terms of increasing shortages of mental health workers. And so, Dr. Flores, you mentioned this a little bit, but I'd love to sort of go a little bit deeper here and hear Dr. Mija's input. How can we rapidly scale a workforce that is really prepared to identify and start responding to mental health impacts as they're happening in communities? What would be some strategies to sort of meet these shortages of mental health workers in Africa?
Yes, definitely. We need to think maybe outside the box. Some of the recommendations that I mentioned regarding implementing culturally appropriate, but also maybe providing strengthened support and training to both the primary care providers that are already there and community health workers and other allied people working already in the communities. So peer training, mental health, first aid, working in support groups. I understand that Samson mentioned as well a really great initiative called the Friendship Bench. That is a good example of working with lay trained people from the communities to achieve that.
Yeah, amazing. And Dr. Mija, I'd love to hear your thoughts a little deeper on this question.
Yeah, that's an interesting question. And what Elaine has said is very relevant and important. Over and above what she has said, like I've said before, we certainly know that in the communities, there are people who work with average ordinary people. So it's very important that we work with those people. They may be the traditional leaders, the community leaders, including the religious leaders. Because what happens if we miss them out, they will give people information that is sometimes not proper or that may fight against what you are doing. I've seen that in many African countries, we have some churches that preach and advise against medical treatment. So it's important to also try to work with them and include and involve them. And also to have each and every organization have some health and even mental health wings, support departments, so that every corner, every place is reached, so that we do not leave anyone behind.
Yeah. It's so important, I think, to really look at the community structures that already exist in communities and say, how can we leverage these existing structures of hope and of healing to really extend into the field of mental health? And I think that's just such a great suggestion. And hopefully we'll be able to sort of see evidence, if we need evidence, I'm not sure, but that these types of programs can work and can be scaled. One thing that I think was really shocking, and we got a lot of comments in the chat and in the Q&A about this, is the lack of investment on behalf of governments in Africa towards addressing these mental health issues. And I'm curious from your perspectives, what is needed and how can we advocate for a larger government focus and investment on mental health?
So there are so many things that can be done, but one thing is not to leave out policymakers in everything we do.
Mm-hmm.
Remember, I talked actually about the transdisciplinary research, where when you are doing research, you make sure that you have them involved.
Mm.
Because we may have interesting and outstanding results, but for as long as we do not have buy-in of the politicians, of the policymakers, we won't do much. So it's very important that we try to reach out to them. Another thing that has been mentioned in various forums is the issue of communicating our results. You see, most of our academic publications are hidden. Not many people, including even researchers, academics, not many people read journals. And even in Africa, they're even expensive because you need to subscribe to them. An article that you write yourself, you may not even have access to it. So it's very important that you also make use of platforms that will reach out to these policymakers. They will certainly not read the journals, but we have platforms for policy briefs, and even there are certain platforms again where academics, researchers can publicize their results in the language that is well understood by these people, not the technical jargon. You may lose them out. And also, it's also very important also to talk to them so that they understand the importance also of research. Mm-hmm. Because we are living in silos in Africa. Each one is doing whatever they want to do without connecting with the next person next door. So it's important that we integrate and connect whatever we're doing. But I really appreciate this initiative because you have brought people sometimes I could not even have been able to meet. For example, from this meeting, I think I should be able to talk to Elaine and also collaborate a lot with her. I've heard from many people here that I think is very important that we connect, even also to make sure that we also subscribe to this initiative by your university.
Yeah, thank you so much, Samson. Amazing, wonderful ideas. Dr. Flores, anything to add to that? We talked about transdisciplinary research, about really speaking to policymakers in the language that they're going to understand, working to break down silos, and working to really strengthen our own knowledge about this through joining the global consortium.
Absolutely, and thank you. I think that, yeah, I completely agree on what Samson has said. I just thinking into, I have a lot of experience mostly in the Latin American countries, and the parallels are striking. Yes, we still work in silos. From the academic and research point of view, we also would need to collaborate with different health professionals and other professionals and NGOs, community leaders, try and form strong coalitions. And of course, it's key that we use our evidence-based research to demonstrate both economic, social costs of inaction, no, on the problem that we have in hand. But also, I am really I mean, I get that we really need to try and engage more, for example, with media to raise the public awareness, try to put more pressure on policymakers that may have their own agenda. However, this requires a lot of input at both the local, national, international levels for this. I think that it's good that we're having, of course, this course and all the other courses that you guys have been organizing, and the increase of interest on the nexus of mental health and climate change. However, some of the specific conditions and also of the let's say they remain hidden. No, there is a lot of new interest. However, there is some basic, very hard problems and challenges of the population that they require urgent care.
Yeah, no, thank you so much. And I think, one of the difficult things about mental health is that people suffer silently, and you can't look at somebody and see that they're suffering from a mental health condition. And so how can we bring more visibility to that, and also, remove the taboos around this, right? Remove the stigma and the shame associated with mental health. And I think, what Dr. Mija was bringing light to is, men as being this vulnerable group that's really suffering deeply, because they're not able to show or tell anybody that they are suffering. And, I think we've been seeing this phenomena sort of globally, Samson, and there's a lot of interesting questions in the chat related to that. And curious what your thoughts are in terms of how do we start to begin to break down those barriers and address, this group that is suffering so deeply but so silently, the men of Africa who are bearing so much of the burden of how climate change is impacting their livelihoods and their futures.
So thank you for that. There are so many ways that we can reach out to them, but we also need to have a certain approach and a certain attitude, one of which is humility. Most researchers, most academics are not that humble, that they cannot bring themselves down to the average person. I remember when I was doing some research out there in the rural areas, I realized that though I was born in the rural area, but I could still learn a lot from people, the common people there. So if I go to the average person, the average man, think that I'm going to teach them one or two things about their lives, I will be very wrong. But I should go to them, try to learn from them, and co-create with them the possible solutions for their challenges. That's one. Then secondly, sometimes we need champions, male champions. Zimbabwe has a very impressive record in terms of dealing with HIV and AIDS. There was a lot of media advocates and even male champions. Because sometimes we cannot deal with most of issues that affect society, especially in Africa, which is a patriarchal society, without involving and engaging men.
Yeah.
And we need to have male champions who would have suffered, but available to share with everyone out there how they went around their problems and how they solved them. And how then, some of the champions that were involved in the HIV and AIDS discourse were religious leaders, pastors and prophets. And I've heard also people asking actually about how men are vulnerable, especially young men. They're vulnerable because of the declining economic opportunities for them. They're vulnerable because they cannot disclose. In Africa, we say men do not cry. And we don't have further involvement programs, initiatives. I was surprised when I visited Sweden last year, realized that they offer paternity leave for men. We do not do that in Africa. Male Africans are not involved in some of those issues. They are not involved in the lives of their children. They offer school fees and food if they can. But to sit down with their daughters, to sit down with their sons, we don't provide such models. If we have such models, then we'll be able to create a society where everyone is comfortable to share their issues, their challenges, and disclose them and seek help. I submit. Yes.
Thank you so much. Yeah, I mean, yeah, wonderful. Dr. Flores, anything to add to that?
Well, actually, just a little things in terms of cultural awareness is so important that we need to engage this type of respected community leaders, elders as advocates for this, highlighting, more stories of resilience rather than focusing on vulnerability. We really need to make a shift in terms of seeking help, being seen as a sign of courage, responsibility, and protection, for themselves and their own family. But yes, it is a huge challenge in our societies. I will come from. I have seen on the first hand and how it's important to establish this type of peer support networks among men who suffer in silence, and that they require a lot of emotional support, especially for this climate adaptation that we require to be able to share experiences without judgment within safe spaces, and is not something that we have. Is something urgently needed.
Yeah, and this issue is I think not just unique to Africa. I mean, I think around the world, in India, in Australia, we've been seeing increased numbers of suicide among male farmers due to drought, due to crop failure. And, also sort of seeing increased rates of fatalities and injuries during these extreme weather events where men are kind of running into the burning buildings, right? Because it's their job to, risking their lives because that's their role in society. And how can we reframe this? I mean, it's a difficult issue that I think that we're grappling with in so many areas of the world. And Dr. Flores, from your experience in Latin America, I mean, I wonder, one of the things that really struck me is how little research we have in Africa around this. Yet we all are saying here, we know this is so prevalent. How can we really learn from other regions while we continue to sort of strengthen, the research focus in Africa around this? One other thing I want to, get your input on, Dr. Flores, and you, Dr. Mia, we talked about the vulnerability of men, but also the issues around vulnerability of women and of young children, and even among young boys related to forced migration. And I'm wondering if either of you have seen any interventions that we think have early signs of success in starting to address some of these huge mental health issues among forced migrants.
So in Zimbabwe, for example, we had a flooding experience related to Cyclone Idai. That was in 2019. People were forced from their homes. And the interventions, most of them involved church leaders because they were very much available. But they needed also training because they were there, but they did not do know what they were supposed to do. So they helped a lot. But then it also emerged from those interventions that cultural beliefs are very important and they need to be taken into consideration, because people, some of them even refuse to leave their very unsafe home environments, to live in safer environments. And even those who had agreed, but they still had those traumatic, post-stress traumatic experiences where they would still have dreams of their deceased family members coming to them. And to help them, of course, the mental health professionals would offer support services, but also there were need for healing that also involved their community leaders, their religious leaders. Everyone else was supposed to be there to offer the support services for everyone. But what I should tell you is that the church is very helpful in Africa in many cases, though we have also cases where the people can experience abuse from some of the church leaders. But the church is very, very helpful in Africa.
Yeah, thank you so much. Dr. Flores, we're at our last minute. Anything to add to that?
Yeah, I would just say that I mean there there is a scarce. You may have some pilots, some very limited interventions that have been trying to see, for example, how to increase knowledge, experiences of displaced girls and women, but it will be linked to health outcomes mostly. For example, contraception and other health outcomes that may be linked to displacement and WASH. But the problem is that we don't have enough, let's say, already implemented and that we have already evaluated their effectiveness. So I cannot say that something that we, yes, that we know. I mean, some of them, there will be linked to mental health and psychosocial support, the early access, and maybe involving some of creative methods to be able to do in the camps. However, there is not many interventions that we can see, and there is a lot that we can do actually. But yes, I cannot share more right now.
And that's okay. I don't think that's because you don't know. It's because we don't have actually great work in this space. And this is a call to everyone here that we really need to be focusing on advocating for solutions, working with governments, doing transdisciplinary research, working in our own communities, advocating to our spiritual leaders and healers, and really trying to raise awareness of this issue. So thank you both so much for these tremendous presentations. And thank you to all the participants here today. We're always so happy to see you here. I just want to give a couple logistic reminders as we close our session today. Reminder here that if you are a faculty member at a degree granting institution of public health in Africa, we would love for you to take our survey. We are trying to understand how issues like this, like climate change and its impacts on health and mental health, are being incorporated into the training of health professionals. We need to know what's happening so we can work on improving it. So please take this survey. The link is in the chat right now. We also have a QR code here so we can get your feedback on this session. And again, huge thank you to our presenters, Dr. Flores, Dr. Mija, you're fantastic. Thank you for the work that you're doing. And I hope everybody stays safe and has a wonderful rest of their day. We will see you all on Thursday. Take care.